My name is Denise Vigno, and I want to welcome you to Howard Center's Marna and Stephen Wise Tulin Community Education Series. While our sessions are typically in person, we're grateful that we've all acclimated to Zoom and other platforms to be able to stay connected. And we very much look forward to when we can come back together again. Tonight, we are pleased to welcome Maureen McGough from the Policing Project for a talk on policing, community relationships, and public health and safety. With this subject at the forefront of the national and local dialogue, we hope that Maureen's perspectives and expertise will help to inform and enrich the ongoing conversations. She'll be joining us in just a few minutes to share the work she and colleagues have been engaged in. Here at Howard Center, we have been working at the intersection of policing and public health for decades. Over 20 years ago, our street outreach team started on the marketplace in downtown Burlington, and today continues to regularly coordinate and collaborate with the Burlington Police Department and downtown merchants around the social service, mental health, and substance use needs of community members. The success of street outreach inspired the development of our community outreach program, a team of clinicians who work with first responders in 9 local municipalities to support unmet social service needs and connection to services. Tonight is a milestone of sorts for us and marks our 40th educational session in the past 5 years. And we've addressed almost as many topics, always with the aim of bringing people together to learn, to respectfully share diverse perspectives, and help broaden our understanding of current and often complex issues related to public health. The opinions and perspectives of our many presenters and panelists, including tonight's, are their own and do not necessarily reflect the position of Howard Center. Before we get started, we want to thank our partner and our friends at Blue Cross Blue Shield of Vermont for their support for our spring series. Thank you. And now our format for tonight, Maureen, when we welcome her, she's going to make remarks. And then once she's through, she'll take questions which may be sent through the question and answer at any time throughout the session. And you'll find the Q&A at the bottom of your Zoom screen or on your Zoom toolbar. And it's also fine if you prefer to ask your questions anonymously. And then during tonight's webinar, your audio, video, and chat functions will not be available. And lastly, the session is being recorded and will be posted in the coming days on our website at howardcenter.org. And now it's my pleasure to introduce Maureen McGough, an attorney and chief of staff with the Policing Project at New York University School of Law, where she oversees national efforts to improve accountability and transparency in policing, reimagine public safety, and improve the representation of women in policing. Previously, Maureen was the director of national programs at the National Police Foundation, and she served in several roles in the federal government, including at the Department of Justice and the Department of State. She's a member of the FBI's Law Enforcement Education and Training Council, an executive board member for the American Society of Evidence-Based Policing, and is a recent public leadership executive fellow with the Brookings Institution. Please join me in welcoming Maureen McGough.
Thank you so much, Denise, for that kind introduction. First and foremost, before I get started, I just want to thank you all so much for being here. I'm looking that we've got over 100 folks here. I know Zoom fatigue in month 11 of this pandemic is a real thing, and it is wonderful to see so many folks coming together to have this discussion on critical issues in policing. I do wish we could do this in person. I have to say, I used to be both a high school teacher and a college professor. And in my orientation for both jobs, they shared that statistic that says something like the human brain is only capable of focusing on a single voice for 12 minutes at a time. And I'm painfully aware of the fact that I'm going to go at least 3 times that long today. So please just bear with me. Hopefully the content is engaging enough that you can stick it out. And for what it's worth, I think I will find speaking for 40 minutes fairly tedious. So we will be in this tedium together. I also want to say a sincere thanks to the folks at the Howard Center, especially Denise. 1, thank you so much for having me. But 2, I just want to say it has been so easy to participate in this fabulous symposium. And I know that if it was easy for me, that means there was a lot of work that happened behind the scenes too. So kudos to you and the team, and thank you again for having me here. As Denise mentioned, I am Mo McGough. I'm the chief of staff at the Policing Project at the New York University School of Law. We're a small but mighty nonprofit, and I'll talk a little bit about our mission in just a second. I joined in May of last year, approximately 3 weeks before the police killing of George Floyd in Minneapolis. So you might imagine what it's been like ever since at a police reform organization. And much of the content that I'm going to be speaking with you about today has really taken off in the last 9 months or so. As Denise mentioned, I previously served with the National Police Foundation, which is another small but mighty police nonprofit. I was the director of national initiatives and research there. And prior to that, I spent 10 years with the US Department of Justice. The majority of my time there was as a senior policy advisor to the director at the National Institute of Justice, which is the research and policy shop. Just so you have a sense of sort of the types of issues I've worked on in my career, so you have a sense of where my perspective is coming from. My portfolio spanned everything from countering violent extremism in the US to countering wildlife trafficking in Kenya and sort of everything in between. But one area where I've always had a particular focus is around systems level reform in criminal justice and exploring the role of police in advancing improved and equitable outcomes. So I think you'll see that sort of theme running through a lot of my commentary tonight. Just a note on the policing project. So our primary mission is to improve police accountability, though we do also work in the civil liberties space, particularly around police technologies. And then most recently, we've really ramped up our work around reimagining public safety, which is what I'm going to be speaking with you about tonight largely. We were founded 6 years ago by our faculty director, Barry Friedman, basically with the idea that we need to improve democratic accountability in policing in this country. And I'll go into what that means in just a bit. We achieve our mission in many different ways. We have social scientists on staff. We conduct individual research. We also do program development and interventions with police departments. We have a shop that produces model policies and legislation, and we're also standing up a litigation arm as well. And in order to achieve this mission, we work across communities and police, really sort of at the intersection. And we also include perspectives from private industries, such as tech around surveillance, and also municipal leadership. Before I go into just the various aspects of reform, some of the national zeitgeist and the missions that are really getting traction across the country, I want to acknowledge the very specific moment that we are in right now. So I've been doing this work for the better part of a decade. I have been fortunate to be working with people who have been doing this work 3-4 times as long as I have. And none of us have seen a moment like the national zeitgeist that we have experienced since the police killing of George Floyd. We are in the midst of a really historic opportunity for just rigorously reevaluating the ideal role of police in achieving public safety and what it is that we need to do across the country to ensure equitable outcomes for all communities. A year ago, some of the approaches I'm going to be speaking about today would have seemed naive or overly progressive. And instead, we find ourselves in a situation where some of the demand for these approaches is actually coming from police themselves. There seems to be a bit of a reckoning that's happened and an acknowledgement that the status quo is no longer how we can and should operate. So I'm particularly excited to have this conversation with you today because it really is an extraordinary opportunity that we have to all work together to improve our outcomes here. One note, though, about this sort of, I guess it's a false dichotomy that's grown up around the conversation around police reform. And it's overly simplistic. I understand why it exists, but one of the things you see when you have these types of conversations is that people immediately go into that headspace of, if you think Black lives matter, you think blue lives don't. I mean, just the fact that the Blue Lives Matter movement rose up as a response to the Black Lives Matter movement sort of implies that false dichotomy. And I think it's really easy for people to just fall into that mindset when they start to think about police reform. Oh, is this pro-community or is this pro-police? And I really encourage you to sort of try and step out of that if you find yourself in that mind frame. Not only is it not necessarily helpful, it's certainly not a workable foundation on which to build any type of systems improvement. it also just completely erases the voice of the Black officer in the discourse. So I just wanted to flag that up front. If you feel yourself sort of falling into that, oh, is this an anti-police discussion? Oh, is this a Blue Lives Matter discussion? It's none of those things. And I think it's important to acknowledge that in most cases, most of us at the table are working towards the same shared mission, and that is improved, equitable outcomes in public safety across all communities. So just keep that in mind if you can. Also, just a shameless plug about the voice of Black officers in this discourse. There's a fantastic documentary coming out, should be within the next month or so. It's called The 54th Mile. And basically, it is 3 police leaders who got together. They are Black men, and in the wake of the police killing of George Floyd, they recreated Dr. King's march from Selma to Montgomery, and they recorded the process. It really sort of sheds light on what it means to be a Black officer at this moment in American history. And if this is an area that you're interested in, I highly recommend that you check it out. And I'll also keep an eye out for when it's released, and I'll email the Howard Center and let them know when it's out. Okay, now that we sort of got the framing out of the way, I'm going to break this talk up into 2 sort of substantive areas. The first is around reimagining public safety. So that is completely redesigning our approach to achieving public safety outcomes. You'll see sort of shades of the defund movement and discussion here, but really the primary goal is understanding what it is communities need when they call for first response and designing systems that actually meet those needs in real time. The second half of the discussion, we're going to be looking at working within the system as it currently exists. So talking about a lot of the police reform initiatives that are getting traction around the country that are really sort of working with police as they exist and just improving the system in a way that actually supports equitable outcomes. Another note, these are not mutually exclusive. And in fact, I think they're probably both critically necessary if we're going to have any type of sustainable change on a national level. Just to set your expectations, I do not anticipate that you will leave this talk with a clear idea of the panacea of achieving police reform in this country, because I don't think it yet exists. I will certainly highlight promising approaches, but I will also make sure to highlight their limitations and their challenges, a lot of which I think don't get discussed as much in the national discourse as much as I would like them to. But one thing I do think, and I hope that you would leave with, is rather than clear answers, a better set of questions, so that when you're advocating for improvements in your own communities, you know what to ask of leadership, you know what to ask of your policymakers, and you know the types of analysis and investigation you should do into the different types of reform that are being floated to know whether or not it's actually going to work for your community as a whole. So without further ado, let's go ahead and just dive right into the substance. Here's the problem when it comes to reimagining public safety. And I should say that police and communities seem to agree on what the problem is. And that is that we send the police to do too much. We send the police to do things that do not align with their skills or their qualifications or their training. And in so doing, we are setting them up to fail. Unfortunately, the impacts of this failure are felt most strongly in Black communities and other communities of color. Because here's what happens when we send the police to do things for which they're not equipped and for which falls outside of the scope of the law enforcement authority. You end up with overcriminalization. If what you're doing is calling 911 in response to a social issue and the only option a community has is to send the police in that moment, you're not necessarily responding with any type of tool to do anything about the underlying problem. And instead, what you see is overcriminalization. Sometimes you see the inappropriate use of force. And again, this shouldn't be a surprising outcome. Law enforcement, the primary tool tends to be enforcement and force. And so that is what is used to solve a lot of issues that they are called to attend to. Another problem of that, though, is that the underlying needs aren't met. And there's a really powerful research out there how a disproportionately small number of community members take up a disproportionately larger number of social services because they end up being the types of people who are, for example, repeat offenders. And again, this shouldn't be surprising either. You know, you take someone who is perhaps living with a substance abuse disorder. They're thrown in jail for a crime associated with their addiction. They don't receive treatment, of course, and then they're released back into the population. and immediately reoffend because the underlying issue was not addressed. That is a complete failure of the system and not at all the fault of any particular person within it. Some solutions that are gaining traction and acknowledging that we ask the police to do too much, particularly in the months that have followed the police killing of George Floyd, is to really narrow the police function, to scope it a bit differently and replace aspects of police response in terms of first response, when people call 911, to something that's more socially focused or a non-enforcement response. These models fall into a couple of different categories, and I think you've seen some of them locally, and they've certainly gotten a lot of national attention. So you either have a model where you have completely alternative responders, so someone calls 911 and the services that are dispatched rather than police are completely alternative response. Or you have the co-responder model, where somebody calls 911 with a particular type of issue, and someone like a social worker, for example, rides along with police and assists in a more appropriate response. Now, I'm guessing if you're the kind of person who on a Wednesday at 6 p.m. after a full workday of Zooms hopped on another Zoom because you want to discuss criminal justice issues, that you've probably heard of Cahoots in Eugene. That is sort of the prototypical alternative response model that's been around for decades and has gotten a lot of traction. But in case you haven't heard of Cahoots, it is a fantastic program full of promise. It is a 24/7 mobile crisis response team that is dispatched in lieu of police, and they handle a host of very specific issues. They do suicide prevention, conflict mitigation between family members, for example, transporting someone who's temporarily unhoused to temporary housing. And research is showing that it is working in terms of reducing demand for police response in these sort of quintessentially social issues. The other model, co-responder models, those are also growing in replication across the country. Philadelphia in particular is doing some fairly interesting work, and it's been growing in the last 9 months or so. They actually embed a behavioral health specialist in the dispatch center, and that person can actually get on the call with a caller if it turns out that there's some type of behavioral health or mental health component to the call, and possibly de-escalate the situation or connect that individual with services without the need for police response. But if there is a need for police response, they are also building a co-responder unit and also offering specialized trainings for certain police officers who are engaged on these calls. So as I mentioned, these are very promising. Other than Cahoots, though, the research around their efficacy is really limited, and that's important because what works in one jurisdiction doesn't necessarily work in another jurisdiction, and we really need to understand what it is about these systems that's making them effective where they are working. I'm going to go into some limitations around reimagining public safety and alternative models, and I cannot stress this enough. This is not a critique on the models that exist. This is just sort of warning flags to you all. If, as you're sort of building new models, if any of them are sort of presented as a panacea, these are the types of questions and flags that you could and should throw in order to understand whether or not you're receiving from your public safety system is actually adequate and grounded in data and evidence. So it's going to seem negative, Nellie, but I promise it's much more of a responsibility framework than a negative framework. One thing, and my guess is also most people on the call understand this, public safety data, it just sucks. I mean, that's like the technical research term for it. It's awful. And it's really hard for us to understand what it is that communities need when they call 911 because the data is so poor. So if you think about it, a call comes into the call center and is dispatched out. The person who's making the call has a very sort of specific understanding of what the reality is that they're experiencing. They probably communicate only some of that to the call taker, and the dispatch sort of classifies that call into one of many preset categories. There's a lot of categories, but there's no way that they could possibly be so nuanced that they would accurately capture the distinction between call types. So it's pretty limited. You can't just use calls for service data to understand what it is that people are looking for when they call 911. You could add sort of an analysis of maybe police incident data. So sometimes what happens is a call taker will take a call, it'll be dispatched at a certain priority level. The police officers will arrive on the scene and realize, hey, this isn't quite the emergency that we thought it was, and we would downgrade the call. So maybe you can sort of add incident data in there as well to understand what it is that people are actually looking for help with. But then you've also got that sort of confounding issue that there are many communities and many people in communities who are actually not comfortable calling 911 for assistance. And that in fact, that there is, for certain incidents, more of a fear of what a police response would do than a need for police response in that moment. So if the real question is, what is it that our communities need so that we can design a public safety system to meet those needs? It's complicated, and it's really hard to know from data the way that we currently collect it. Another thing that's cropping up, and I think is keeping a lot of people up at night, myself included, is sort of the overly simplistic way we talk about a shift from criminal justice systems to public health systems, for example. So, you know, a big driver behind the defund movement and behind sort of the interest in redesigning public safety systems is, of course, disparate outcomes and the acknowledgement that the criminal justice system is one that is sort of built on this inherent systemic racism that needs to be addressed. And in a lot of models, you see sort of this overly simplistic approach where it says, okay, we're going to carve out X% of this criminal justice response, and we're going to make it a public health response. That approach sort of assumes that the same type of systemic racism that plagues criminal justice systems also doesn't plague public health systems when we know that's just not true. You know, systemic racism is something that we have to confront in all of our public systems. And I think one thing that the pandemic has certainly shown us is that public health is not immune from disparate outcomes. So we can't just sort of reclassify which public system takes over certain parts of community needs. We need to do so in a way that's mindful and actually addresses the underlying systemic racism in these systems in order to achieve better outcomes. The other thing that these alternative models assume is that dispatch will know at the time of call whether an alternative response is needed or a police response is needed. You know, it really is all about identifying risk, and there's very, very little research that's supporting dispatch decision making. You know, they really are just doing the best they can with very limited information, with very little support in a very short amount of time where the decision making is critical. And if you have an alternative response model, getting that risk determination wrong is probably inherently going to cause harm in some way. So if you think about it, what we're dealing with now is what happens when you send the police when they're not needed, right? That's when you see the overcriminalization and possibly excessive use of force for things that are inherently like a mental health issue. But then you've got the inverse. What happens if you don't send the police and they are needed? Then you certainly have a greater public safety threat and a threat to whatever professional is responding in lieu of the police. So the risk determinations are really critically important, and there's very little research out there to help those dispatchers make better decisions in real time. So that is something that it's not necessarily a bar to these alternative responses, but it's something that we have to keep in mind if we're going to avoid repeating the mistakes of history. The other thing to think about too is if these decisions are highly subjective, we risk history repeating itself, because I don't think it's that hard to imagine a scenario where, absent more stringent evidence-based protocols, alternative responses get dispatched more often to white communities, and traditional police responses get dispatched more often to Black communities and other communities of color. So it is something that's really important to pay attention to, and really underscores the need for robust data collection around the implementation of these alternatives so that you can start to identify any disparities that exist early and intervene to correct them. The other thing I want to point out is that a lot of these alternative models only address a really specific type of call. And why that's relevant is that I think in a lot of communities that are seeking to sort of smaller the footprint of the police, they assume that by just implementing these alternative models, they're going to take some of the burden off of the police department and then can shift resources away responsibly. Mental health calls in jurisdictions where they've been able to do this type of analogous or of more rigorous research they make up a really small number of the reasons why people call 911. So if you're implementing a mental health focused alternative, for example, it doesn't necessarily mean that you're going to alleviate the burden on your police department in a significant way. Not saying that you shouldn't pursue these models, not saying that, I mean, of course, it's critical that a person in mental health crisis receive mental health support, but just don't expect to necessarily relieve the burden on the police department in the process. Other things to consider are the availability of 24/7 response. So Cahoots in Eugene is an anomaly, and 24/7 response is expensive. And part of the reason why police have sort of grown up to be the de facto responders to absolutely everything is because they're one of the few public entities that is available to be dispatched any day, anytime. Not saying that you can't build an alternative that is available to be dispatched that way, but again, there is a pretty significant cost associated with this. Another thing to consider, and I feel bad, this is all like negative Nelly stuff, right? But I'm about halfway through the modification considerations, and then we'll go on to more optimistic fixes, right? Another thing to consider is practitioner implications. So, I've been in a lot of discussions with police communities, researchers, a lot of really rigorous and productive debates around what the future of policing should be in achieving public safety in jurisdictions across the country. And very few times have there been mental health practitioners in the room, for example. I mean, we certainly have representatives from public health sort of at the macro level. But what we are talking about in a lot of these alternatives is saying that 2 a.m. call for a person in mental health crisis who's known to have a mental health issue, that's no longer going to be a police response. That's what the mental health professionals are going to handle. That's a little bit different than what a lot of mental health professionals thought they were signing up for when they decided to pursue that profession. And I think it's really important that we gauge the interest and ability of the people who currently hold those jobs to shift responsibility and take a much more proactive approach for the 24/7 coverage that's needed to be successful. The flip side of that too is if you really narrow the police function, you're going to impact the interest of people in the profession and the type of people who are interested in doing the work, which we'll talk a little bit about in the second half as well. But, we work with police quite frequently in achieving our mission, and many of the police we work with are drawn to the service orientation of the job. The fact that there's an enforcement component on it is secondary, tertiary even. And the idea of being that social worker who goes out at 2 a.m. when no one else is willing to be there is part of the reason why they were drawn to the job in the first place. If you start to create a profession where those types of officers leave, I would posit that those types of officers are the types of officers we want to keep on the job. So it's just something to think about in terms of a possible downstream impact that with very particular and mindful planning, you can maybe prevent on the front end. One thing that always comes up when we talk about alternative models, and I would imagine is maybe one of the first things that popped into your heads of things we should think about, is the pervasiveness of firearms in this country. I probably don't need to tell you, we have significantly more guns in this country than people, significantly more guns per capita than any other country in the world. I think the only other countries that are close to us are Yemen, and I forget the other one. Somebody set me to rights in the Q&A with the second closest country, but it's pretty significant. And I'll tell you, I lead a team of North American researchers on this global project with the Global Law Enforcement and Public Health Association. And what we're trying to do is really get a handle on all of these alternative models as they exist around the world, and see if there's a way that we can maybe create some shared metrics and start to see how the implementation of these types of programs might change outcomes globally. It's really exciting work. And, part of our interest is to see if there's any promising practices that are happening around the world that maybe we want to consider for adoption here in the US. But inevitably, when we have these conversations, somebody from the US, and I have been this person, will sit back as, one of our international counterparts is speaking passionately about the promise of their approach. And we'll just sit back and say, like, okay, so how many guns do you have? Right? Oh, not many. Yeah, we've got like more guns than people here. And we're not really sure if you can just have all of these robust alternative response strategies when there's a risk of firearms for every call that you go to. And I've learned, though, that it's actually not that simple. So, we've been working with some chiefs from areas of the country where they have a very high percentage of gun ownership. In fact, it's so pervasive that they don't even consider the presence of a gun in a home as any type of additional risk when they're figuring out what an appropriate response is to a particular type of call, assuming that they would know that there's guns in the house. So I think the point is it can't just be as simple as we have a lot of firearms, so we need a lot of armed responses. It's more nuanced than that, and it's something that we're certainly studying and trying to get a handle on. But I just wanted to flag that as something to think through. And then relatedly, with the prevalence of firearms, there's also extraordinarily high rates of violent crime in this country. It was interesting. I went to check where Vermont sort of fell in violent crime nationally, and y'all are actually like 49 out of 50. So maybe this is a little bit less relevant for you all. And if anything, we should all be coming to Vermont and learning how the heck y'all are doing it. Congratulations. But the relationship between the size of the police force and the prevalence of violent crime in a jurisdiction, it's complicated. I don't want to make it seem like it's as simple as saying, your violent crime is increased and you need more police. It doesn't necessarily work like that. What's really more important is what the police that you have do, where they do it, how often and how predictably they do it. It's not necessarily that you just slap some more officers into the budget if you see an increase in violent crime. That being said, sometimes that is what happens. And if you look at Minneapolis, where they have seen an increase in violent crime, that's sort of the epicenter of the defund movement. And 2 days ago, they just added $6.4 million to the police budget to increase the number of officers they have. So that is something to consider as we redesign the system. We really have to figure out how to build the plane as we fly it, because we have to address the violent crime that is happening in a lot of jurisdictions while also figuring out the best way to right size the police response. Not to say that it's not possible, just again, affirming this is really complicated. So just try to avoid oversimplification of what the best answer is. And again, I can't stress this enough. Those flags were not to say that these alternatives shouldn't be tried. In fact, in many jurisdictions, I think there may be some of the best chances we have to reduce bad outcomes and improve equitable outcomes. I think the point is to just make sure that these alternatives are implemented in a way that is mindful, and that whenever you can, you're collecting data around the impact that these alternatives are having to make sure that you're actually having the impact that you intend to have. You might ask yourself after all of those caveats about how difficult and challenging this is about, okay, well, what's the ideal solution if things that we've floated thus far aren't quite cutting it? And I will sort of let you in on the Policing Project's moonshot idea. We haven't actually published on this anywhere, and we're still fundraising for it, really in the nascent stages of it. But I think it's worth talking about here just to give you an idea of the realm of the possible. Basically, the idea is that if you knew why communities called 911, if you knew what emergencies communities were experiencing, and for what issues they required public responses and support, what profession would you design? It probably wouldn't be police as the primary generalist responders. And the emphasis on enforcement and force, while a necessary part of the job, it would be sort of a tool of last resort as opposed to a tool of the first instance. The training would probably be pretty different, much more significant, and would mirror much more closely things like social work and education and nursing and psychology. So what we are doing is actually embarking on developing an entirely new model of first responder, developing the training and curricula that would support that first responder and the leadership structure that oversees it, and then working with pilot sites to see if you can't have a generalist responder with enforcement authority that's just much more, their training and skills align much more closely with the actual underlying and overt needs of the communities they serve. Like I said, it's a moonshot. I can't even begin to tell, the price tag on it is in the tens of millions, and the timeline, I think, in most of our proposals are about a decade out. So please don't rest on your laurels, hoping that there will be a brand new first responder profession that you can implement in your jurisdiction. But I just, like I said, wanted to give you a heads up of the types of conversations that are out there. Like I said, that's a perfect example of the kind of thing that before the police killing of George Floyd was a theoretical concept that people sort of got behind in terms of its logic, but never thought that there would ever be a way to implement it. And now it's looking at the very least possible, if not plausible. Okay, just sort of looking at time, I'm going to shift at this point to talking about working within systems as they currently exist. There is so much happening in terms of police reform between the zeitgeist that followed the police killing of George Floyd and the change of administration that seems to be really focused on improved outcomes and sort of integrating criminal justice and public health to focus on community resilience as opposed to arrests and crime rates and things like that. You know, and even if you are a jurisdiction that's reimagining public safety, you will still have an enforcement agency at the end of the day, unless you're a jurisdiction where abolition is the name of the game. But I haven't seen any jurisdictions really taking up that mantle. So even if you are a jurisdiction that's doing the first part of this conversation, you should still sort of explore the second part of this conversation, because it should be effective in improving your outcomes for the law enforcement agency that remains. One of the biggest focuses for the policing project is around police accountability. And simply put, policing in America has an accountability problem. There isn't a ton of it, and what does exist tends to occur on the back end. So after something's gone wrong. So you have things like civilian review boards that maybe, you know, members of the public are able to sit on, and they review things like agency discipline in officer misconduct. What we are advocates for at the policing project is really around front-end accountability. So it's the idea that policing is a public institution, and because it is a public institution, the public deserves a meaningful say in how it operates with regards to strategies, public safety priorities. And that's really not a foreign concept in most government entities. And if you think about it, you know, your school board probably wouldn't change a bus route without some type of public forum, but your police department might be able to purchase surveillance technologies that the community feels are highly invasive without so much as a conversation. So it's really about making sure that there's space at the table at the front end for public voice and input into things like policy development and public safety priorities. And if you think about it, it's not just sort of a democratic requirement in our government. It also just makes good sense for achieving better public safety outcomes, that public safety is something that you co-produce with the communities you serve. You know, there really is no better insight into the challenges a community is facing or the strategies that might be most useful in addressing those challenges than the lived experience of the communities that police departments are serving. So that's one of the things we're focusing on in terms of accountability. A related aspect of that is about transparency, so particularly around police policies and practices. One thing that we've been working with jurisdictions across the country to do is to make their police manuals publicly available. So a police manual is a compilation of most of their policies and practices, and it sort of governs how an officer is supposed to act in various situations. The public needs access to police manuals to know if the way that they're interacting with police officers reflects what is expected of those police officers in terms of agency policy and practice. But we surveyed the 200 largest agencies in the country, and 40% of them don't put their manual online. Of those that do put their manual online, most are not adequately accessible in the sense that they're not searchable, or the policies in them aren't current, or the text isn't machine readable. So if you're looking for sort of quick fixes and wins in a jurisdiction, making the agency policing manual public is a great way to start giving the public the visibility that they deserve into police policies and practices. I apologize, I didn't check to see if Burlington Police Department was published, but I would imagine that it is. Another thing that's come up a lot is around basic minimum standards for policing. It probably won't surprise you that they don't exist, but it is something that has gained a lot of traction, particularly since the change of administration. There are over 18,000 police departments in this country and no basic minimum standards that govern them. There is something called CALIA, which is an accreditation process. It is voluntary. It focuses largely on police operations. And at any given point, only several hundred of those 18,000 police agencies are accredited. It also tends to have a bit of a size bar on it. You have to be sort of a certain size in order to be able to manage the accreditation process. And the vast majority of police departments in this country have less than 50 sworn officers in them. So it can just be a little bit complicated to achieve accreditation. We're in the middle of actually developing those basic minimum standards now through a project we have called Health Check. And basically what we're trying to do is answer the question, how do you know if your police department is a good one? Some people would use crime rates as proxies, but there's so many other things that affect crime rates. And you could have a jurisdiction with really low crime because the police are abusing people's individual civil liberties and rights under the Constitution. So you can't just look to crime rates. What we're doing is we're creating a series of hundreds of metrics that do everything from look at, to what extent does the police department protect First and Fourth Amendment rights and civil liberties? Are they policing equity? To are they achieving their public safety mission? To what's their organizational efficacy? What's the diversity of their force? How good is the training? How unbiased is the promotion process? And then also looking at accountability. So what is their complaint process? How accessible is it to community members? How quickly do they address them? Do they have front and back end accountability measures and the like? And that's something that we'll be launching later this spring. We're also looking for pilot sites to implement it. So if there's anyone from Burlington PD on the call or anybody knows anyone from Burlington PD, we'd love to come work with y'all. And just a couple of more things. I know we're getting a little bit close on time, but I think they're worth mentioning. One is the importance of the evidence-based policing movement. That's something that's really gained traction, I'd say, over the last 5 years or so. But at the end of the day, there are very few professions where the actions of the practitioners in that profession could be life and death. Medicine is one of them. And I don't think any one of you would feel comfortable going into an emergency room if you found out that the doctor learned about the procedure that they're using from the doctor in the next jurisdiction over, but they didn't actually read any journal articles about it. And they're not really sure if there's any evidence that supports it. Unfortunately, in policing, there is research out there that shows that the way that police chiefs get their information most about what strategies are going to be effective are looking to the police chief in the neighboring jurisdiction and seeing what they did and if they liked it or not. But the reality is there is a growing body of social science research out there about what works and what matters in policing. And evidence-based policing is sort of growing up to say police policies and practices must at minimum be informed by the latest available evidence out there. I think a really interesting aspect of the evidence-based policing movement is it is being driven almost entirely by sworn officers themselves. A couple of ways that that's manifesting. One, there's an organization called the American Society of Evidence-Based Policing, and full disclosure, I'm on their board, so I'm a little bit biased, but that was a coalition of sworn law enforcement officers, most of whom who just went out to get their PhD, not because it helped their career, but because they cared about what worked and what mattered, really coming together and trying to inspire the integration of scientific evidence into policies and practices around the country. Another program I want to highlight is Law Enforcement Advancing Data and Science. Full disclosure, it's something I started when I was at DOJ, so again, I'm pretty partial to it. But it's the idea that mid-career officers who are either conducting their own research or who are part of researcher practitioner partnerships, that they should receive some type of career development support so that we can sort of get to tomorrow's chiefs and ensure that tomorrow's leaders in police actually care about the data and evidence that inform the profession. I know we're short on time, but I do want to squeeze this sort of last part in because it is extraordinarily near and dear to my heart. And I think at this particular moment, my personal priority, and that is advancing the representation and experiences of women in policing. So currently across the country, there are only 12% of sworn officers who are women, 3% of police leaders who are women. And these numbers have been pretty stagnant for decades. While I do believe gender parity is important, that's not at all why I'm driving this issue. It's actually a public safety, I think it's fair to say it's a public safety crisis. There's research out there, and it's growing, that police, women officers and men officers perform differently on a host of metrics that we really care about. So research shows that women officers use less force and excessive force. They are better able to interact with diverse communities. They achieve better outcomes for crime victims, especially victims of gender-based crimes. They also are named in community complaints less. They're named in lawsuits less. Because of that, there's even some research that indicates that they're cheaper to hire because they won't cost the city anything in payouts. And I would say if there was a training out there, right? If there was some training that police departments could implement that would guarantee that they would have decreased uses of force, they'd have better outcomes for crime victims, they'd interact with the communities better, they get sued less. Every department in the country would probably be clamoring to implement that training. And yet you don't see the same emphasis on improving the representation of women in all ranks of law enforcement. I first became aware of this issue in 2018 while I was at the U.S. Department of Justice. And there was a captain at the time from the Newark Police Department, Yvonne Roman, who basically challenged me in her very endearing Jersey way to put up or shut up, to say, she pointed out, you say you care about what works and what matters in policing. Here's all this research, and yet these numbers are at 12% and 3% of leadership. What is the DOJ going to do about it? So in 2018, we hosted a national summit. We brought together women leaders in policing, mid-career officers, line officers, and a ton of academics who were doing the work to really understand the role of that gender played in police performance. Basically, we sort of created this framework for how to not only advance the representation of women, but improve the experiences of women who are already in the profession. And I'm very excited to say on this call, and again, I think this is the first time I'm talking about it publicly, and I actually don't know if I'm clear to talk about it publicly through our strategic comms firm. So if anybody asks, you didn't hear this from me, but we're actually launching a pledge, and it's called the 30 by 30 pledge, with the idea that we're trying to get to 30% of recruit classes being women by the year 2030. We'll be launching it in March to coincide with Women's History Month. What the pledge is, it's a series of low and no cost actions that a police department can take. It's really, a lot of it is around data collection and diagnosis to help a policing agency sort of understand where bias may be and sort of identify changes that they should make internally. And then also spells out really basic minimum practices to ensure that a workplace is a safe place for women and supports their success. Two things to be aware of. There's studies that show 93% of women officers experience sexual harassment at some point in their career. And also there are few designated spaces for nursing mothers. So a lot of your nursing mothers are pumping in their cruisers. So, little shifts like that are sort of low-hanging fruit, and we're working to sort of implement that broadly across the country. I can't share who signed on to the pledge yet, but I will say we've got this really fantastic mix of amazing, major metro police departments. We also have really small police departments from rural jurisdictions who barely have any women on staff at all, and sort of see this as an opportunity to remedy that problem. So I don't know, hopefully 2 years from now, we'll come back and say that problem is fixed. We fixed it, and all the other stuff we're still working on. But I just wanted to throw that out there. And again, would love for Burlington PD to be a part of it. So if anybody wants to chat about that, I'm all ears. I want to make sure there's still time for questions. So I'm going to cut it off there, but happy to send along additional materials if there's any other information that folks want.
Maureen, thank you very, very much. That was excellent. A lot of information that you've provided. So we do have a number of questions that have come in. And so for our viewers at home, what we're going to do in this last about 25 minutes, keep sending your questions in. We'll get through as many of them as we can. I've been looking through them. Some of them, maybe Maureen has partially answered, but we'll still ask and see if she has anything to add, and we will end right at 7:15 so that you can go on to have dinner and do whatever else. So great. So the first one, Maureen, what would you imagine the difference would be between a traditional police department and a Department of Public Safety? What would you suggest the process might be to lead a community to that transformation? And I bet maybe there's something in between now, today, and your expensive moonshot, maybe?
Absolutely. That's a fantastic question. And I think the first thing that I would recommend a jurisdiction do is define what they mean by public safety. You would be surprised how many different outcomes could be captured under that umbrella. So I think, not to sort of put it back on you, but part of that is sort of up to the priorities of the jurisdiction. And then I think it really is a lot about sort of the process that I started to describe. So really getting a handle on what it is that your communities need, rather than focusing on what laws need to be enforced, and sort of flipping the script on what the priorities are. It's going to be a really data-driven process. It needs to be a multi-stakeholder process. And once you sort of define what public safety looks like, you need to understand what public resources can be brought to bear to achieve those outcomes, and make sure everybody has a seat at the table to sort of design what that process looks like. And then also, I mean, my guess is that additional resources will be required. So seek to set up public-private partnerships, take a look at federal funding and state level funding, and just make sure that you have sufficient resources to support the alternative model. But that's a really good question. For what it's worth, we're actually embarking on a really rigorous research project to spell that out in great painstaking detail. And so we should have an initial draft in about 9 months.
Great, thank you. Question 2, do you think it is important for citizens to have oversight of policing? If so, how best can that happen so that officers feel confident in the process?
That is an excellent question. And I think, historically, the word oversight is a really loaded term. And that's part of the reason why we approach it from a democratic accountability lens. At the end of the day, police officers are public servants. I think a lot of police officers are drawn to the position because they are public servants. And because of that, the public deserves to be a partner in the production of public safety. I think especially when you're talking to police departments around the idea of front-end accountability, it's really important to remember that, this isn't just about democratic principles, it's about improved public safety outcomes. The more you can have a working relationship with your community, the more you can have the type of feedback loop where you're getting real-time insights into challenges and priorities and resource needs, the better able you'll be to design a particular public safety strategy that meets those needs.
Great, thank you. There's a few on education and training. So let me start with this. Should police academies be required to include in-depth education on the history of policing in the United States and the impacts of systemic racism? If so, what would be the process necessary to implement these additions to curriculums nationwide?
That is an excellent question. And police training, I think, is probably worth an entirely different symposium presentation. But I will say, I do think you're starting to see a shift towards that, not just in training, but in the profession as a whole. At the IACP conference, I think 5 years ago, and that's the largest international conference of police executives, there was a chief there who stood in front of the entire audience of sworn officers and publicly acknowledged policing's role in the perpetuation of slavery in this country. And it was, at the time, a really controversial moment. And today, I think you see a lot of discussions in police departments starting from that moment, that acknowledgement that there is a history that has to be reckoned with, that the problems that we have today are there for a very specific reason, and they need to be mindfully addressed if we're actually going to see improved outcomes. So I know that doesn't directly answer the question, but I think the whole profession is sort of ready for that, at least in some jurisdictions. The other thing to remember too is that because there's no sort of basic minimum standards, that training standards across the country are completely different. So you might have some jurisdictions that really only have like 16 weeks, and you might struggle to sort of fit that into their 16-week curriculum. Others have up to 6 months of training, and I think you'd be much more likely to integrate it there. I'd also recommend going through posts. A lot of states have organizations that really oversee training for all law enforcement agencies in the states, and that's a great way to sort of broadly affect change, at least at the state level.
Great, thank you. In your policing priorities for the new administration, you note by executive order require that all of the more than 80 federal law enforcement agencies meet basic standards for transparency, including making public and easily accessible basic information about the agency available. Can you tell us what these basic standards of transparency are and why this is important in communities such as Burlington?
Yes, absolutely. That's a great question. So we do have a transparency framework. If you just Google Policing Project Transparency Framework, it basically outlines everything that you need to know in terms of what should be made publicly available. Part of that is the manuals that I discussed earlier. So making sure that the public has access to how it is that the police officers and law enforcement officers in the federal arena are supposed to act, so that they can determine whether or not they're being treated the way they're supposed to be treated. Another thing that's really important is around making data public and easily accessible. So as I mentioned, policing data and criminal justice data generally is not great, but it's also not very available. So even if it's imperfect, the public still deserves access to it. One way you could do that with federal agencies is to streamline the way they define use of force, for example, streamline the way that they capture data related to uses of force, and then make all of that data public. That would be a huge transparency win. That would be transformative.
Great, thank you. This next question, this presentation offered such a refreshing tone for how a community might have this conversation. There is so much rancor, acrimony, and blue lives versus black lives in our community dialogue that I fear everyone loses in the conversation the way it is currently occurring in our community. Do you have any specific support for how a community avoids the vitriol and has respectful, compassionate, evidence-based, and productive conversations that honor the humanity of all involved? Great question.
Oh, that's such a great question. And if anybody figures out the answer, please follow up and let me know. No, I think the thing that comes to mind immediately, and I will say, I don't think we have perfected this as an organization, and we certainly have had conversations that devolve into that dichotomy. It's part of why I'm so conscious of it. But it's just starting the conversations off with an orientation to the shared mission. You know, if you are in the room talking about police reform, it is safe to bet that you are working towards equitable outcomes and improved public safety across all communities, and just keep orienting towards that mission. That's what most, if not everyone, well, most people are really looking for. And if you start from that place, I think it's maybe a little bit easier to find consensus earlier on in the conversation, but it's a really good question and it's a really hard one.
Great, thank you. Do you have any materials knowledge on the role of effective communication with the public in improving public health?
Could you repeat the question?
Yeah, do you have any materials and/or knowledge on the role of effective communication with the public in improving public health?
In improving public health specifically, no. But in general conversations with communities towards outcomes that I imagine would be shared outcomes with public health, yes. And we're actually sort of in the middle of finalizing those community engagement materials. I will say they were ready to go out before the pandemic, and I think that changes significantly how it is that people can have these types of cross-community conversations. One thing that is, I think, more important than anything when you're having these types of conversations is empowering your community participants with a basic standard of knowledge of what it is that you're talking about. You know, we who live in this space all the time understand the nuance, we understand the details, and then we come to the community and we say, okay, what do you need? And it's the Henry Ford thing of, if you ask me what I need, I'm going to tell you a faster horse rather than give me a Model T. So making sure that if you are integrating communities into any type of strategic discussion or any type of orientation around improved outcomes, you make sure that there's an education component so that everybody's speaking from the same playbook and empowered with the same amount of knowledge.
Makes complete sense. Thank you. Next question, is there any data on the impact or school resource officers? Do we really need cops in schools at all?
That is an excellent question. There is research on it. I haven't read it in years, so I'm not going to speak on the record about it. But I know if you do look to the National Institute of Justice, I think it was in the years after Sandy Hook, Congress appropriated hundreds of millions of dollars for research specifically on public safety in schools, and there's an SRO component to that research. So I would definitely encourage you to look there.
Great, thank you. Next, how do some of the police reform efforts specifically address public safety intervention with youth?
That is an excellent question. So I haven't seen any. That doesn't mean that it's not there. At least in the type of focused work that we're doing, we consider youth part of the community. So of course they're represented in the community discussion, but we haven't developed specific interventions focused on things like juvenile justice. There's certainly room for it. I just think we haven't gotten there yet.
Great, thank you. Let's see, they're still coming in. Has Maureen seen communities where a positive community conversation has been able to happen that brings together both racial justice activists with local government and others who might not just want to slash or defund police? It feels like in our own community, at least Burlington, this conversation so far is still so adversarial. How do we get past the attitude that's there, that there's only one right way to do this and reform law enforcement? And I think you touched on that previously. Mm-hmm. Anything else to add there?
I would just say to be patient with yourselves. It will not surprise you that the dynamics that you're describing are dynamics we are seeing all across the country. You know, I've heard the analogy that you know, a lot of this work around community engagement and collaboratively developing public safety responses, you know, that's something that you do before a crisis to handle it better, and it's something you do after you've healed from the crisis. But right now, I think we're still really raw in the aftermath of George Floyd, and I think there's a lot that we still need to navigate in terms of harm and hurt, and just give yourselves space to navigate that.
Thanks. Okay, they're still coming in. Is there any data on the difference between community perspective calling for social support when the support is a police department employee versus a community provider?
That's an excellent question. That's exactly the kind of thing that we're hoping to explore with our research. Obviously, community trust and sort of community senses of police legitimacy, they're essential for achieving public safety in a jurisdiction. And our hypothesis is that the more you have particularly socially focused, aligned responses that address community needs, that perspectives on the system, particularly with regards to legitimacy, will improve. But I haven't seen any research that gets at that yet. Doesn't mean it doesn't exist. It just means I haven't seen it yet.
Great.
But we're hoping to produce it too.
Yeah, more work for you.
Yeah, great.
Next, should police disciplinary proceedings be made public? If so, how would you deal with police unions that vigorously oppose making these proceedings public?
I really hoped that I wouldn't do this to any of the questions, but I know enough about police bills of rights and police unions and police discipline to know that I'm not informed enough to give you an answer that will help you understand it. I thought the other stuff was complicated. I think this is the quagmire of all quagmires. So I'll pass on that one.
Okay, that's fair enough. And there's a couple other about police unions. So let's just keep going through here and see what else we have. This is about, there's a number on education, and I know you already spoke to that. Let's just ask this one. Would it make sense to alter criminal justice education to include more alternative response training?
Yes, absolutely. And there's CIT training is something that's pretty popular around the country, and there's a really strong evidentiary base to support its impact. And that's basically, ensuring officers have specialized training in crisis intervention, de-escalation, a lot of basic mental health intervention principles. And that is really rigorously supported by research. So I think CIT training in particular is a huge opportunity.
Great, thank you. A few more, let's see. You may have touched on this a bit. How do current recruitment practices relate to racism and sexism in policing?
Oof. This is one of my favorite topics. How much time do we have? So I'm gonna answer that with an anecdote first, and it's particularly with regards to gender diversity. But we're finding that this is just steeped in intersectionality. So a lot of these issues are certainly overlapping. But at the summit in 2018, we heard about a small jurisdiction, a small police department, less than 10 sworn officers, that did not have a drone in their equipment portfolio, but they had a recruitment video that showed a police officer hanging out of a helicopter with a giant gun strapped to his chest. This police doesn't have a drone, but they've got a helicopter recruitment material. And a lot of what's out there, I think, tends to perpetuate the sort of hyper-masculine notion that policing is something that tough dudes do, that requires a ton of strength, and that you're going to be in physical altercations, and that sort of brute force is what's required for you to be a good officer. So you see recruitment material like that, and then you look at the problems we're having in policing, and it's not hard to understand why, if that's how jurisdictions are framing what the job actually is. The job is very different. We know that most of what police officers spend their time doing is talking to people. So we need to start making sure that recruitment materials are accurate about what it is that police do, and accurate about the skills necessary to be an effective officer.
Great, thank you. So this is a question that really follows George Floyd and everything that happened over this past year. It's long. In June 2020, the city of Burlington passed a resolution to lower the number of officers at BPD from a maximum of 105 to 74. We're currently at 84. With the reduction in officers, there are concerns that there will be a loss of the midnight shift and cutbacks in other programs such as the domestic violence officer. What are some solutions that have worked in other cities to cope with a reduction of officers in the police force?
That is an excellent question. And I think that that gets at some of sort of the complicating factors that I was alluding to earlier. I think jurisdictions need to expect that if they are engaging in downsizing their police department, that some of the interventions that they value in terms of their sort of pro-social impact will likely be impacted. Part of what we've explored just minimally is, whether or not there need to be quite so many police departments. So if you're in a jurisdiction that is surrounded by many other law enforcement agencies, maybe they're not as large as Burlington's, but you cover very similar area, you see very similar public safety issues, perhaps sort of blurring jurisdictions a little bit, joining forces, having mutual aid agreements, that kind of thing, just working more closely with your neighbors, though I imagine they're probably struggling with staffing as well. There are things like staffing studies and formulas. I don't know how great they are, that can help jurisdictions determine the optimum number of officers needed based on their population and public safety challenges. So if there's a worry about the size of the department, that's one way to go. But I don't think there's an easy answer for that. I think, it's a values decision that the jurisdiction needs to make, and they need to make it with extremely heavy input from the communities that they serve.
Great, thank you. Very helpful. There's a number of additional, let's see, next. There has been some news lately that implicit bias training in Vermont is not impacting the disproportionate number of traffic stops of Black people. Can you point us to evidence-based information about how to address implicit bias among police?
That is a great question. So the research on implicit bias training is still emerging. But one of the things that we're seeing in implicit bias is that the research shows it does change officer attitudes, but there's insufficient research that it actually changes officer behavior. And that is obviously sort of the primary thing that you would be interested in implicit bias training doing, is actually changing outcomes in these communities. Rather than looking at implicit bias training, at least at the policing project, what we would suggest that you do is look at the utility of traffic stops. So we did a lot of research, and it was before my time at the policing project, so I can't speak to it with great specificity, but we ran a sort of racial bias audit of traffic stops in Nashville. And we found that there was a sort of disproportionate number of stops were for Black people and other people of color in the jurisdiction. And we also found that traffic stops that were used sort of pretextually to try and get at some other public safety outcomes, that they didn't actually work that way. So one of the big defenses of the traffic stops in the jurisdiction was that, we need to use them to sort of get at these bigger crimes. We didn't actually see that outcome, at least not for the period that we studied. So I would suggest I'm not saying, every jurisdiction needs to get rid of traffic stops, but just think critically about what it is that you're using the stops to do, and whether or not a police officer is really the person that you need to do that work.
Wow, Maureen, you're incredibly well informed. Thank you. Any thoughts about the issues of separating local law enforcement from federal law enforcement issues like immigration?
Ooh, okay, that is a great question. The policing project, I should say, does not necessarily work in the in this particular space. So I'm just going to speak to you as just me as a person who's sort of been in this space and worked at the DOJ for a while too, and sort of saw how these trends are working. I feel very strongly that local law enforcement should not be involved in immigration enforcement. They're two extraordinarily different missions, and one of the most foundational things that a policing agency can have in order to improve outcomes for their community is the trust of that community. And if you become sort of aligned with any type of efforts at deportation, you lose that trust, and you particularly lose that trust in one of the most vulnerable aspects of your community, and that is people who are out of status. So I feel very strongly about it, but our organization doesn't really necessarily do that work, though I would guess they would probably feel the same.
Great, thank you. Just time for maybe one or two more. It seems like as alternatives to police begin to be implemented, there is bound to be a learning curve and effectiveness curve. And as a result, there may be instances where, because of the newness of these services, mistakes are made. Despite the fact that this will give feedback and improve the services, it's bound to provoke criticism saying that these changes aren't working and we need to go back to the old ways. How would you, or have you, countered that backsliding narrative?
These are such great questions, my gosh. So that is something we experience in pretty much all aspects of police reform, right? Municipal governments and municipal government agencies are notoriously bad at innovation, and it's because we can't waste public resources. So there is an inclination, if you get early bad results, for example, to shut down a program. We try and orient jurisdictions toward a culture of learning. So, you want to be in a situation where really early if something isn't producing the outcomes that you want, but you want to be collecting enough data and, having enough evaluation associated with a new approach that you can also articulate why you're not getting the outcomes that you want and then make necessary changes. So I think, really orienting this towards a culture of learning as opposed to just, we figured it out, we're going to do this thing and everybody can expect improvements, and then you end up wildly disappointing people. And then also being really specific in your communications with communities so that their expectations are appropriate. You're trying something new and you can't make guarantees, but here is the sort of theory of change on which you are basing your activities, and then you just go from there.
Great, thank you. So, two more. One is actually looking to how we would be in touch with you. Certainly, if they were in touch with me, I could provide that information, and or we found you online.
Yeah, I'm first name dot last name at nyu.edu. Happy to hear from anyone.
Great.
Yeah.
And then I think just time for one more. Do you see a role for the primarily community-based practice of transformative justice in redesigning public safety in the criminal justice system?
Yes, absolutely. I think that is a sort of a critical component. I haven't seen it play out in any jurisdictions that I've worked with yet. I think it's certainly something that people acknowledge as sort of a critical approach, but I don't know of any sort of case studies that we can point to for how sort of transformative justice and just that like basic acknowledgement about the power structures that need to change in order to, ensure that communities are co-producing public safety. But I think that's where we're headed. And I'm really optimistic about it.
Great. Maureen, thank you very, very much. I wish we could give you a round of applause. Very well informed. Thank you for sharing your expertise. I know almost 50 questions, and I apologize, folks in the audience. We just couldn't get through that many, but maybe we can invite you to come back at some point.
Happy to, and don't hesitate to reach out if there's anything that you want to follow up on.
Great, thank you very much. And then to our viewers at home, just a few things. We're going to send an email with our feedback survey. If you would be kind enough to complete that tomorrow when you receive it, it really helps us in selecting topics and presenters for the future. So that's that. And then upcoming free education series events, Dr. John Brooklyn on March 9th, and then Aaron Rolke and Millie Richard on April 6th. So please join us there. And then just lastly, our annual spring conference is coming up on March 30th, and we have some wonderful national speakers coming in. So really appreciate everyone's time tonight. It is very hard to Zoom after Zooming all day. So thank you, and we hope we see you back here again very soon. Good night. Thank you, Maureen.
Oh, thank you all. Have a good one.